How to interpret indeterminate TB IGRA results. Have you ever received an indeterminate result from a tuberculosis interferon gamma releases assay, or IGRA? This can be confusing, so let's break it down. IGRAs are blood tests that help detect if your immune system has responded to Mycobacterium tuberculosis, the bacteria that causes tuberculosis. When the result is indeterminate, it means the test didn't clearly indicate whether you have a latent tuberculosis infection or not. So, what causes these indeterminate results? One common reason is that the positive control, which checks if your immune system can respond, didn't work as expected. This could happen if your immune system didn't react adequately during the test. Another reason could be a high background response in the negative control, which can also lead to confusion. Certain groups of people are more likely to get indeterminate results. For instance, individuals with weakened immune systems, like those living with HIV or on immunosuppressive therapy, may not respond strongly enough. Young children can also show indeterminate results due to their developing immune systems. Additionally, technical issues or improper handling of the blood sample can contribute to these unclear outcomes. Now, what does this mean for you? An indeterminate result doesn't confirm or rule out tuberculosis infection. It can create challenges, especially for those at higher risk, such as individuals from areas where tuberculosis is common or those who have been exposed to someone with the disease. Because of this uncertainty, it's often necessary to repeat the test or explore other diagnostic options. If you find yourself in this situation, what should you do? First, consider repeating the IGRA test, making sure the sample is collected and handled correctly. It's also important to take into account your risk factors, history of exposure, and overall immune health when deciding on next steps. If the repeat test is still indeterminate and there's a strong suspicion of tuberculosis, additional tests may be needed. These could include the tuberculin skin test, chest imaging, or microbiological studies. It's crucial to have a healthcare professional interpret these indeterminate results. They have the expertise to evaluate your situation thoroughly. Decisions about treatment or further testing should weigh the risks and benefits, especially considering any potential side effects of therapy. In summary, an indeterminate IGRA result means the test couldn't definitively confirm or exclude tuberculosis infection. This situation requires careful consideration, possible repeat testing, and sometimes additional diagnostic methods to ensure you receive the appropriate care. Always consult with a healthcare professional for personalized advice and guidance.